Guys, so this is still on introduction, the foundational ethical concepts and historical perspective of ethics in nursing. So the first question here that we are answering is that why are we studying ethics in nursing? So basically, it's to do good to our patient and for us to know also how to identify what is good and what is bad. That's the purpose why we are learning your ethics. Now, if you would look at the earlier discussions, it has taught us that there are different types of ethical dilemmas. There are also different types of moral distress. So class, when I say moral distress, if I would go back to the definition of moral distress, your moral distress is defined as a situation. It is a situation wherein one knows the right thing to do, but the constraints make it nearly impossible to pursue the right course. Okay, again, when one knows the right thing to do, but the constraints make it nearly impossible to pursue the right course of action. What do we mean by that? For example, if you're taking care of your patients, there are instances that you would want to do something for your patient. There are times wherein you know what is the ideal care for your patient. And here comes your patient saying, "Nurse, I don't have the money. Nurse, I don't have the resources." So what's the tendency of the nurses? The nurses class would come to a point and think, this is a distressing situation. This is a situation of distress. Imagine you would want to do something for your patient, but then your patient could not afford it. So that's moral distress. Now, other than your patients, other than the staff nurses, the students also are exposed to moral distress. So students may have a lot of experiences also that could lead to moral distress. The same with your staff nurses, okay, and then your new nurses. Why? What are these? What are the effects? No, if this moral distress would remain unaddressed, what would be the effect on the part of your patient, of your nurses, or even any personnel? One, it could result from the withdrawal from the moral dimensions of patient care. Now, what do we mean by that? For example, if you continuously experience, guys, moral distress, and then it is not being addressed, what happens? Sometimes the nurse would think, I will not mind the moral aspect of care. It is too tiring. Nakakapagod mag-isip tapos hindi naman pwedeng gawin. So tendency class is that moral distress would lead to withdrawal from the moral aspect of patient care. Next, moral disengagement leading to ethical insensitivity. What do we mean by ethical insensitivity? Because of the prolonged time that you have been in moral distress, di ba, come to think of it, you know what to do, you know that there's something that needs to be done, however, your patient could not do it because of the lack of money. The tendency is that the nurse would experience frustration. And the nurse would continuously experience frustration. And then sometimes plus the nurse experiences anger, and then sometimes the nurse experiences guilt. All of this combined could lead towards ethical insensitivity. All of those combined could lead towards ethical insensitivity. In other words, parang nagiging insensitive. In other words, parang nagiging manhid na lang kasi because of the constant exposure to this problem. We don't want that to happen. Then you have your burnout. We oftentimes say that your burnout is your severe stress. Your burnout is considered to be severe stress. And then later on, ultimately causing nurses to leave the profession. Okay? You know why? I've known of several nurses who left the nursing profession because they could not tolerate what's being happening to their patient. They could not tolerate seeing what's happening to their patient. They could not tolerate the pressure that they have in the workplace. And for that reason, they are leaving the profession. Now, what does this give us as a message? Later on, guys, if you will become nurses, you really need to consider the morality of the issue. And then, class, you need to ensure that what you're doing is that we act on ethical guidelines. So we consider the morality of the issue and that we act based on ethical guidelines. Why? If you will not be acting based on ethics, the tendency is that you will be leaving the organization still. Okay? And we don't want that to happen. In research, guys, we commonly refer to this one as intent to leave. Okay, we have what you refer to as your intent to leave. And there are not a lot of nurses who are leaving recently because of this issue. Now, about for the new graduates, there is always a dilemma and uncertainty through practice that is not aligned with expectations. Okay? To put it lightly, please do not copy word for word that is in your textbook. Class, to put it lightly, there is always a versus between ideal and real. There is always a versus between the ideal and the real. What do we mean by that? New graduates, guys, would usually picture an ideal environment. The new graduates are thinking, okay, I will just give medications. I will just render the care that are available to my patient. But here comes the real situation. What's the real situation? You're dealing with poverty. You're dealing with staff shortage. Okay? And all other issues that arise in the environment. That's why class, the students or the new graduates would usually have moral distress also. They also have moral dilemma. Imagine at school now, di ba? At school, you are taught, for example, if you're doing what are the procedures that have been done at school? Let's say, for example, insulin injection. Okay, I'm not so sure if you've done this in fundamentals of nursing, but one thing that we teach in fundamentals is insulin injection. Guys, what's the route again of insulin injection? Is it given IM? Is it given subcutaneously? Or is it given intradermally? If you can recall, what's the route of administration of your insulin injection?
Subcutaneous, sir.
Okay, very good. So class, this one is given subcutaneously. This one is given subcutaneously. Now, look at this situation. If I will be giving class insulin subcutaneously, how many times can I reuse the syringe and the needle? How many times should I use the syringe and the needle?
Isa lang, sir.
Once, sir. One
Right?
time lang.
Once, huh? Right. Okay, very good. That is only used once. That is how we taught you because that is how it should be. But come to think of it, guys, if you will go to a district hospital, you will encounter patients who will tell you, nurse, is it possible that you will just use that needle that you used earlier in the morning? We do not have the budget to buy for the new needle. Okay? Those are things that you encounter and you will be thinking, what should I do? Okay, what should I do? Should I really require the patient to buy the syringe and the needle? Or can I really use the old one? So you have to think and you need to analyze critically if what is best for the patient. That's what's happening in the real setting. Next, there is also vulnerability to the negative culture because of bullying. Okay? What do you mean by bullying? When I say bullying, somebody is more aggressive, somebody is more influential, somebody is more powerful compared to the victim. Okay? Compared to the victim. Now, let us not undermine bullying. Oftentimes kasi, for example, I will say, if I will be teasing somebody, okay, I will say, for example, hey, you're cute, you look like a baby, or let's say, for example, you look like a pig. Okay? Sometimes we're just making fun of it. Okay? Sometimes we're just making fun of it. And yes, it might be fun if person A is just equal to person B when it comes to power and influence. It's okay, that is fun. But if it comes to the extent, for example, that person B is already being demeaned, for example, person B is already being put down because person A is a very strong personality, plus bullying would occur. Bullying would occur. Now, why is it that we are really not into bullying? Why is it that we always say no to bullying? Because class, your bullying have implications to the mental health. Your bullying class have implications to mental health. Usually, dear students, victims of bully are usually those victims of bullying, are usually people who would have low self-esteem. Low self-esteem. Why? What's the tendency? Their tendency is that, kadalasan, for example, among pediatrics, you would notice this child who would say, hi, I won't go to school na. And then they would say, bakit hindi ka pupunta sa school? I just don't want to go to school. I feel tired today. And then later on, you will discover that it's because somebody is bullying him at school. Okay? Somebody is bullying him at school. For that reason, he does not already want to go back to school. Now, what do you mean by exclusion? Okay, when I say class exclusion or exclusivity, let's picture, for example, a certain hospital. And then this certain hospital would say, I will only hire graduates from school A. That's a culture of exclusivity. Okay, that's a culture of exclusivity. Okay, and then here comes you, a very good student from our school, and then you would apply. Even though you are a very good and excellent student, they would say, don't accept him because he is not from school A. Okay, so right there and then you are already exposed to the negative workplace environment, and we don't want that to happen. Okay, we do not tolerate. Now, being a scapegoat, what happens among new nurses? Okay, among new nurses, the tendency is that si ano yung may kasalanan. It was the fault of the new one. Kasi nga he's a new one. He does not know what to do. Okay? Oftentimes we hear those comments in the clinical setting. Whereas supposedly, if you are the new one, you are supposed to be the person that needs to be oriented. Okay? What do we do? Later on, once you will have your work class, you always look for orientation. You always look for training. And then you always look for preceptorship. Okay, you always look for these three things once you will start your work. You could not properly do your work, guys. You could not properly do your work without orientation. That's not possible. Okay? Without training, that's also not possible. And when I say class preceptorship, that would mean that there's somebody in the person of a preceptor that you would shadow. When I say class shadow, parang anino kanya, parang shadow kanya. Kasi you are following him or her and he acts as your mentor. He acts as your mentor. Okay? That's one way, no? Because oftentimes they would hear the thing, okay, it's his fault. He's new. Don't want that to happen. Don't want that to happen. Then you have also class what you refer to as collegial incivility. Class, when I say collegial incivility, class, kumbaga, di ba oftentimes we use the expression na, okay, civil kami. Okay, civil kami. Halimbawa, civil kami ni Nona. We are talking to one another. Angela and I are civil. We are talking to one another. So in the same way, when I say incivility, class, you act not like a civilized man. You act as if you don't have the attitude. You act as if you don't have the behavior. Picture this example. No? You are in the hospital setting. It's your first week of work. And then somebody, okay, and then somebody, class, no, and then somebody would say na, sige, class, somebody, class, would say na, ay, wag mong tanggapin yan. Or somebody would say to you na, why are you even here? Why are you working here? You're not supposed to be here. Okay, or you would encounter people who would just be mad at you, who would just be suplada to you without even a reason. That could be collegial incivility. And we don't want that to happen. We don't want that to happen. Okay? Then you have new graduates that experience disillusionment from lost ideals about ethical practice. Why? For example, right now, I might be teaching you along the way what is the right thing to do to the patient. And then when you go to the clinical area, somebody will tell you, no, that's the wrong thing to do. That's not the right thing to do. That's how we do things here in the hospital. Do not follow what you learned in the undergraduate. That's useless. So you are in an illusion to think, oh, what's happening? You are in an illusion to think, okay, what's happening? Okay, what's really happening on the ground? Okay, that's disillusionment. Then other than that, guys, for the nursing students, okay, oftentimes you are perceived inexperienced among the healthcare team. And that's why the students would say, okay, I might not have the experience. I will not just embark on it. Okay, I will not just be doing this because I'm inexperienced. Then the nursing students may have the tendency to ignore morally distressing situation to avoid conflict and confrontation. Kasi oftentimes you're being told, hey, you're just a student. Okay, don't mind that. That's the problem of the staff nurses. You're just a student. But that's a wrong notion. Okay, that's a wrong notion. Guys, as a student, yes, that's true. You have a lot to learn. Even by the time that you would graduate, if you can recall what Patricia Benner has said, you are still considered to be novice nurses. You have a lot to learn. But never ever think that you are incompetent. Never ever think that you are inexperienced. Because that's the reason why you are learning nursing. Now, let's talk about some basic ethical concepts. Our focus in ethics is to talk about human acts. Our focus in ethics is to learn human acts. That's our focus in research. Now, what do you mean by human acts? Guys, the big word maybe that you need to write there on the side is that it's a voluntary act. Again, it's a voluntary act. Now, what do I mean by voluntary act? Guys, when I say it's a voluntary act, is it conscious or unconscious? When I say voluntary act, conscious or unconscious?
Conscious.
Conscious, sir.
Very good. Meaning, class, when I say human acts, the person who is doing it is conscious. For example, right now, I am conscious that I am talking to you. Talking to you, discussing to you is an example of a human act. In other words, class, I am acting based on free will. Okay? When I say free will, dear students, is there coercion? Is there coercion? When I say free will, guys, is there coercion? Sige na. Is there coercion when I will talk about free will?
None, sir.
None, sir.
Class, there is no coercion. When I say free will, student, there is no coercion. Plus, when I say coercion, when I say that you are coerced, in other words, plus there's presence of force. For example, if somebody is pointing a gun here with me right now and then tell me, hey, you need to discuss. That's not free will. That's coercion. Okay, that's coercion. Now, take note that when I talk about human acts, there is no coercion, there is no force being applied because this depends on the judgment and choice of the humans. Okay? Now, plus you take note, we need kasi to differentiate between human acts and acts of man. Okay? Those are the two things that we need to differentiate for this afternoon. The human act and then the act of man. Now, class, for the human acts, so as I mentioned, voluntary, it depends on the judgment. It entails a moral responsibility. Now, look at this. You are acting on free will. You are acting on free will. Since we're acting on free will, you need to have moral responsibility. Okay? In other words, class, you are conscious. Alam mo kung anong ginagawa mo. Nobody forced you to do it. In other words, class, these actions of yours would have moral undertaking. It would have a moral responsibility. It would have a moral bearing. Kasi at the end of the day, you know what you did. Now, this also human acts class is the form, it forms the human personality and structure. And as they say, the doing or the absence of doing builds the kinds of life the person lives. Okay, that is how we define your human acts. Now, let's go to acts of man. Okay, or first before that, let's talk about let's capture the words of Saint Thomas Aquinas first. So Saint Thomas class is actually among the first ethicists that we can call. Now, he said that human acts are said to be proceeding from will. In other words, class, what comes first? Is it the will or the human act? What comes first? Is it the will or the human act?
Oh, will, sir.
Okay,
Will,
so class,
sir.
it is the will. If you would look at the word of Saint Thomas Aquinas, it is the will that takes precedence before somebody would go towards the human act. Okay? So in other words, when I say class will, ginusto mo. It is your drive. It is your inner drive that you would want to do something. And class, it is like your motivation that you would want to do something. Now, acts that are performed by the individual which are not subject to his will and reason are not called human acts, but rather they are referred to as natural acts. Okay? Now, let's put it simply, huh? Let's put it simply. Now, class, it says here that if you did an act that is not subject to your will, we don't call that human act already. Okay? If it is not subject to your will, we don't call that your human acts. We refer to that one already as natural acts. Or class, ang complete na term for this one is natural acts of man. Okay? So again, to simply differentiate, pag may will, human act. Pag no will, that's natural acts of man. For example, right now, breathing. I'm breathing. Do I need to think that I am breathing? I don't. Okay, because that's automatic for me that I am breathing. In other words, class, that automaticity of my breathing is referred to as human acts po ba siya or acts of man? Yes?
Acts
Okay,
of
that
man.
is considered to be an act of man. Or in other words, natural acts of man. That's why it's referred to as natural acts of man kasi nga it's natural. It's coming on naturally. I'm doing it naturally. That's why it's referred to as acts or natural acts of man. Okay? I hope that with that, you'll be able to differentiate it already. Sige, let's clear. Now, the question here is, what is the difference between human acts and the natural acts of man? You have class human acts. Okay? Allow me to go back to human acts. When I say class human acts, it is conscious. In other words, pinag-isipan ko. I was able to think that this is what's supposed to be done. And then class, it is done freely. Okay? It is done freely. To take note of the two words there, class. Human acts, it's done freely. Now, there are essential qualities. Okay, class, there are essential qualities or constituent elements of human acts. Look at that one. That would be K, F, and V. Take note of that. Human acts. When I say human acts, K, F, and V. Now, what is this K, F, and V? Knowledge, freedom, voluntariness. Okay? Now, let's say, for example, okay, human acts. Human acts is that I administered medication to my patient. That's a human act. I gave a medication to my patient. That's a human act. Okay? Now, question, do I have the knowledge if I will give this medication to patient? Yes, I know that I will be giving the medication. Second, do I have the freedom to give the medication to the patient? Yes, I had the freedom to give the medication to the patient. Is it a voluntary act or did somebody force me? Nobody forced me, so it's considered to be voluntary act. That's why, class, it's considered to be a human act. And look at the words there, that the man is considered to be responsible into these actions. In other words, in the example that I've given you, if something went wrong on the medicine that I've given my patient, if something went wrong on the medicine that I have given my patient, class, what could possibly happen? I will be the one that will be held liable. I will be the one that will be held responsible. Because after all, I have KFV. I have knowledge, I have the freedom, I have voluntariness. It's a human act. Okay, it's a human act. Kindly take note of that. Now, if I would look at the next one, the natural acts of man. Natural acts of man beyond consciousness. In other words, we can say na parang instinct. We can say that it's parang self-defense mechanism. We can say that it's not dependent on the intellect and the will. We can say that it's not dependent on the intellect and the will. Okay? Let's say, for example, I am taking care of my patient in the ward. And then I am very cautious. I have prepared all the medicines. And then here comes, I'm holding the medicine right now. And then suddenly, the child of my patient ran towards me. And then I spilled the medicine. Okay? I spilled the medicine, for example. That was beyond me. Okay? That was beyond my control. That was involuntary on my end because it's not even my act. So class, that will not count as my liability. Perhaps a better example could be that we can think of is those actions that are unconscious, those actions that are involuntary, semi-deliberate, and then spontaneous actions. Now, for example, if you are in a physical combat, let's say, for example, that somebody attacked you, and then suddenly you've also punched that person because he attacked you, plus the punching action that you have done would actually count as a natural act of man. Why is it considered a natural act of man? Because it was involuntary. It was your defense mechanism that you just punched that person because he is attempting to attack you. Okay? That's unconscious. It was just only your second thought that you would want to defend yourselves. Now, another example could be the usual acts that we do. No? For example, breathing, defecating, urinating. These are considered to be natural acts of man. Okay? For example, you are inside the elevator and then you could not stop your fart. Hindi mo mapigilang umutot. Okay? Is that what would you consider that? That could actually be counted as a natural act of man. Why? Okay? It's done without knowledge, it's without consent, and then it's involuntary. Okay? For that example of farting, the main criteria there is that it's involuntary. Okay? So, another example is that when your patient are considered to be psychiatric patients, when we are dealing with your psychiatric patient. Okay? Allow me to give an example. A very good example perhaps is a patient with schizophrenia. Okay, class, schizophrenia is a concept that will be introduced to you in psych nursing. But if you've heard in health assessment, I think there is some mention of schizophrenia. Okay. Now, class, what happens there in schizophrenia? Okay, class, in schizophrenia, class, the patient becomes unconscious. Okay, the patient becomes unconscious. Okay. For example, no, have you heard of those news that there are people who we call buang, and then the tendency is that if you will ask them, why did you shoot that person? And then they will say, no, I did not shoot a person. I did not shoot somebody. I was shooting on chickens. Okay? Pagtingin niya class sa tao, manok. That's a psychiatric problem. Diba? Oftentimes, if your patient are also taking drugs, that could also possibly happen. And then, for example, if this patient suddenly hurt you, and then, for example, the nurse is approaching, and then the patient suddenly did this. Okay? Tapos parang nasaktan ka, class, that could still be counted as natural acts of man if your patient has schizophrenia. Why, class? Okay? Your patient might be looking at you and then they think that you are a big spider that they don't want to see. They might be thinking that you are their enemies that they don't want to see. Because, class, these people with schizophrenia have lack of consciousness, have lack of consent, have lack of voluntarism. Okay? Now, I could not say that he did that with knowledge because he has schizophrenia. When I say class, schizophrenia, altered ang thinking ng pasyente, altered ang orientation ng pasyente. So your patient is unable to decide properly. And then class, kung sinaktan ka ng patient mo, that hitting you class, is only an involuntary act because he thinks that you are another object, another thing that he hates a lot. Okay? So that's one thing, no? That's one thing. In the court of law, for example, okay, these people with schizophrenia could not be imprisoned because of committing a crime when they are on the psychiatric state of their disease. They can only be held responsible during their lucid intervals. They could only be held responsible during their lucid intervals. What do I mean by lucid intervals? Picture that this patient class is nagbubuang, picture that this patient is disoriented, and then suddenly parang naging okay siya. Whatever he did on the time that he is okay, that would already be considered as a human act. Eh, yung mga ginawa niya na sa time na okay siya, that is considered to be a human act. But those things that he has done beyond those times is already considered to be acts of man. Okay, because the tendency class is that, sabi nga nila, no, others would describe it as animalistic behavior. But we do not say that about our patients, but others would say animalistic behavior. Okay? Now take note that acts or the human acts when he employs his intellect and will in performing that act of man. Okay, so class, just think of the words that for the natural acts of man, it's unconscious, involuntary, semi-deliberate, and then spontaneous. Okay? Now, let me see. Okay, so class, I think for this time that I would end my discussion here and would continue it later.